Hello. So this week's podcast was about creating a Netflix type subscription based payment for medical procedures. So basically, this was a TED Talk by Jean Manuel Izaret, and he brought up a very interesting point. He basically started to talk about what it would be like if we took a subscription based plan, say, for instance, like how they do with Netflix, like how you pay a subscription based on how long and how you want to use it for a multitude of services. Like you get a bunch of movies for one price per month or per year. And he insinuated that we should follow that model for healthcare procedures. So, one of the main reasons he started talking about this was because he brought up the point of if you were to buy a car, paying it in installation payments, subscription based payments, compared to the initial, say it's $30,000. Paying that in installations of $500 per month would feel and be kind of overall not cheaper, but it would be less of a large increment of money going out at one time. So it would make it more affordable and easier for people to pay, because I don't know about you, but it would definitely be easier for me to pay that $500 bill a month as opposed to dishing out $30,000 that I definitely do not have. So he brought this up for healthcare procedures. He mentioned that a lot of the curable diseases that people have, such as, I believe he brought up the point of a liver transplant. It's curable, you just need a transplant. But because of such like a steep cost, I believe his model was around $300,000. Because of that steep cost, people are unable to go and get this treated, and unfortunately a lot of times that does result in fatality, which is very sad, because if they had the money, they could be cured and they could potentially go on to lead a normal life. So with this subscription-based plan, the payers would be paying money to, it would overall, he points out, be a better scenario, because what would happen is early on in these treatments, the patients would be able to pay for treatments like, for example, before you need a liver transplant, before it gets to that extent, paying for a treatment halfway through that would potentially cure your illness before it gets to the point of needing a liver transplant. You'd be in that middle ground where you'd be able to pay for a overall cheaper treatment before your illness progresses to the point of needing a full-on transplant, or even just paying at the very beginning for preventative care like checkups and that kind of thing. So overall, there would be exponentially a lower cost because you are paying essentially for preventative care almost. So I have a lot of questions about this subscription plan type of outlook. Like, for example, would there be interest? Would the overall price of what you're paying be higher because you're paying it in monthly installments instead of just paying it in a one-time fee? And also, how would this exactly play into insurance? I believe he said insurance would be the payers, but how would this change that system? My biggest question really just comes into play with the interest. Would the cost exponentially increase to where you were honestly ending up losing a lot more money as opposed to just paying that upfront cost that initially is a large investment, but at least it's overall less? I believe this could be very beneficial to people who, like I said before, don't have that big amount of money to dish out in the very beginning. However, it could leave you in a potentially deeper hole. which is very concerning. So I feel like I have heard about a system like this before. Maybe not. This feels like it's not the first time I've heard about this, which makes me wonder, is there a system in place that's kind of like this right now, or is this potentially just an idea that is being toyed around with? I also wonder if there will be different tiers to the plan. Like, for example, how Netflix has with ads, so it's cheaper, or without ads, so it's more expensive. Would it be based on, like, for example, if you're in good health, okay health, or poor health? Would you have to pay more if you're in poor health? Would you have to pay less? Would it be income based? I think there's a lot of factors and a lot of variables in this scenario before I could really truly say, in my opinion, I think it would be a good idea. There's just a lot of things, a lot of questions that I have that are left unanswered. But honestly, I really would be more interested in learning more about this topic. I think it could potentially be a very good thing. I just think there's a lot of things that we need to figure out before we implement something like this.